As we come upon Suicide Awareness Month, I think that, medical students, residents, and fellows are at risk. Why? They're working very hard in a very stressful environment and sometimes can feel quite isolated. What we need to do is we need to try to get some recognition, and we need to make sure that people realize that they're part of a community and they're part of an important community that's here to try to help them. When I went through medical training, we didn't have the 80-hour work weeks. We worked 120 hours plus. It was difficult to decompress because you were either on call, you were post-call exhausted, or you were pre-call and you wanted to get to bed so that you could take call the next day. But I think as I've moved along in my career, I do a couple things. I am an early riser, so I get up every morning at 5 o'clock and run for about 40 minutes a day. I decompress. I also take trombone lessons once a week. On weekends, I hike or sit in my pool, and I like to read fiction. I think the important message is what I do may not be right for everybody, but it's important to take time out of your week to do something that's important to you, that allows you to relax, allows you to be a little contemplative, and allows you to put things into perspective. I think it's important for folks that are feeling a lot of pressure to realize you're not alone, that there are others that probably feel like you do. Talk with friends, talk with your faculty, talk with community groups. If you're a member of a church or a synagogue, talk with people there. Get out and enjoy the beauty of our state. As it's starting to cool off, there's just great hiking here. Even if you're alone in your own head hiking, it's going to be really important to just get in the mindset where you can put things into perspective. So the school was founded with the intent to care for our community, and that's really our mission, and everything we do reflects back to that mission. A couple things. We have a psychiatry training program. We train 10 people a year that go out into the community to provide mental health care. We also oversee the only child psychiatry program in the state. And what's interesting is the American Psychiatric Association listed Nevada as being a critical shortage area for child psychiatry services. Since our fellowship program has been in existence, we're no longer a critical shortage area. And that's because a large percentage of our graduates have stayed to practice in this community. And finally, we also oversee a couple and family therapy program, folks that directly work to impact the mental health of our communities and families. If one of your friends or family members is having problems with depression or suicidal ideation, I want to remind everyone to call or text 988 for immediate services. This is akin to 911 that you would use for emergency services, but 988 is specifically for these mental health concerns.